Remember, we saw that the two vertebral arteries give off branches which meet at the median sulcus of the medulla oblongata to form the anterior spinal artery. And they call it the anterior spinal artery because it's going to descend down on the anterior surface of the spinal cord, supplying it. That's why they call it anterior spinal arteries. But when these anterior spinal arteries are descending down on the anterior surface of the spinal cord, it is getting compensatory branches from the intercostals. And then the spine will have the cervical spinal arteries supplementing the anterior spinal artery in the neck region of the spinal cord. And then we'll have these intercostal arteries also supplementing the anterior spinal artery within the thoracic portion of the spinal cord. And then the lumbar spinal arteries also supplement the anterior spinal arteries when they're supplying the lumbar portion of the spinal cord. So this anterior spinal artery, much as it supplies the anterior part of the spinal cord, it gets compensatory branches from these other arteries, which are the segmental arteries. Then we saw on the posterior aspect of the medulla oblongata and the spinal cord, the posterior spinal arteries, which were branches of the posterior inferior cerebellar artery. There were two, one on the right, the other one on the left. These two posterior spinal arteries are the ones which are going to supply the posterior surface of the spinal cord and the medulla oblongata, of course getting compensatory branches from the neck and from the thorax and from the lumbar region. That is how the spinal cord is supplied. Anterior spinal, posterior spinal arteries, there are two. They are getting compensatory branches from these segmental arteries. So we can see the anterior, this is the cross section through the spinal cord. And you can see the anterior spinal is one, but the posterior spinals are two, one on the left, the other one on the right. They give off branches which penetrate deep into the substance of the spinal cord, and then they will supply the bundles or the tracts within the spinal cord. The anterior spinal contributing to supplying the anterior portion of the spinal cord, and the posterior spinal contributing to supplying the posterior portion of the spinal cord. And these are the compensatory branches which are also supplementing them, so that the spinal cord is at all times supplied with blood.